One, two, three, four.
Hi friends, welcome back to Smile Nursing Tutorial. Today we are going to know about the administration of oxygen in the sick child, why it is important and how to administration of oxygen, the purpose, equipment and precautions to be taken while administrating the oxygen. The topics we are going to discuss one by one. Coming to the administration of oxygen, actually, oxygen is necessary to control anaxemia, which may be caused due to lack of oxygen in the inspired air. Okay. Next, decreased respiratory center or inadequate oxygen in the lungs. Next, oxygen therapy is frequently used in the treatment of children suffering from airway obstruction, pneumonia, cardiovascular disease and other hypoxic status. Okay. So, how much concentration during therapy is given? 30 to 40% of oxygen is given to the sick child. Coming to the methods of administration of oxygen. So, one is nasal catheter, second is oxygen by mask, third is oxygen tent, and fourth is oxygen hood. Fifth is incubator. These 5 methods of administration of oxygen can be used according to the child sickness condition and doctor advice. Okay. Now we will see first nasal catheter, how to administer oxygen in that. This method is used for older children. Before administering nasal catheter, it should be checked for the potency. Catheter number is 4 to 6 and is used only 7.5 to 10 centimeters. The main purpose is hypoxemia, hypoxia and respiratory distress post anesthesia. Coming to the equipment, oxygen tent with lid, oxygen source, jug or bucket, Macintosh, thin plastic sheet, sterile oxygen tubing, clean tubing and duster. It is inserted through the nostril into the nasopharynx. It is removed every 8 hours. The oral hygiene should be maintained and amount of administered according to the age of the child, that should be monitored and should be written in the case sheet. For infant, the flow rate of oxygen is 1 liter per minute. For young children, 2 liter per minute. For older children, 4 liter per minute. And also, according to the severity of the sickness and with doctor advice, we have to administer the oxygen to the sick child. Now we will discuss about the oxygen by mask. It is very useful method. I think everybody knows this method. Why? Because whenever the patient need oxygen, we will put oxygen with by mask. When we want to administer oxygen in the babies and children, it is a very useful method, giving oxygen by the face mask. And size of the mask should be checked before giving the oxygen by the mask. The mask should be well fitted over the nose and mouth. Why? Because to prevent escape of oxygen and to prevent discomfort. We have to remove every 4 hours for wiping out the face and for providing comfort to the child. After that, again we have to reapply oxygen by the mask. So this method is very easy and also allows the freedom of movements of the child, and the amount of oxygen concentration can be properly controlled by this mask. Coming to the incubator, if a neonate is placed in an incubator and it requires oxygen, how we will give oxygen in that? It can be provided with the oxygen through a port for passing tubes. Okay, we have to take some precautions while giving oxygen to the children's. Oxygen cylinder should be checked to see whether it is filled or empty, and position of the child is very important, and child should be placed in propped up position. Oxygen fluoride should be placed in propped up position. In most of the conditions, 40% to 50% of concentration of oxygen is required. Observation is very important while giving oxygen to the child. We have to check the color of the skin and mucous membrane, and also respiration and pulse. That should be monitored and should be recorded. Main thing we should know, if we will provide high concentrates of oxygen, what should happen? High concentrates of oxygen for prolonged period can damage the immature retinal blood vessel in a premature infant. So, for that reason, we should be very careful while giving oxygen. So, just I will advise everyone should aware that oxygen, how much we have to give and which method we should give, and also which precautions we should take while giving the oxygen therapy to the neonate. Thank you for watching this video.